Hello, and thank you for joining today's webinar, Getting Started with QPP, an overview of MIPS for small, rural, and unserved practices. Today, Adam Richards, Health Insurance Specialist with the Center for Clinical Standards and Quality at CMS, will provide a brief introduction. Other speakers for today's call include Molly MacHarris, Mary Wheatley, and Dr. Ashby Wolf. You can listen to the presentation through your computer speakers and provide feedback through the chat box. Following the presentation, we will open up the phone lines for your questions and feedback. Any questions not answered on the phone should be directed to the QPP Service Center. The slides, recording, and transcript from the webinar will be posted on the Quality Payment Program website in the next week or so. I would now like to introduce Adam Richards. Adam, you may begin.
Great. Thank you, everyone, for joining us, and welcome to our discussion on getting started in the Quality Payment Program, and really, more specifically, getting started with participating in MIPS, the Merit-Based Incentive Payment System, for the first performance year, which is currently underway. We designed the elements of this webinar a little differently than which you may be accustomed, and that is largely because of the anticipated diversity of our participants. Some of you may have a background or previous experience in CMS reporting programs. Some may not have as much experience. Some may be from small practices, while others are from, maybe medium-sized or larger rural facilities. Regardless, we've embraced this diversity, and we welcome all of you, and we will do our best to provide you with the straightforward basics of the Merit-Based Incentive Payment System. So let's get started. We'll go to the next slide, please. For the Q&A session information, just a brief note, we will answer as many questions as time allows at the end of the presentation. If your question is not answered during the webinar, there are some contact information there for you. And please note that we will be taking questions via the phone. The Q&A chat box is really meant for technical issues only. Next slide, please. So the Quality Payment Program is comprised of two tracks from which clinicians may choose. The Merit-Based Incentive Payment System is which we will cover in some depth today, as well as Advanced APMs, or Advanced Alternative Payment Models, which we won't have a lot of information on, but just as a brief overview, Advanced APMs are really a subset of alternative payment models, which let practices earn more for taking on some risk related to patient outcomes. We have additional information available for those interested in advanced APMs at qpp.cms.gov, or you can also visit our Innovation Center for a number of resources, a lot of great resources, so we encourage you to take a look at those. Next slide, please. So the discussion structure for the webinar today is divided really into two parts. The first part is, what do I need to know about MIPS? And this is where we're going to cover the basics, eligibility, participation, elements of reporting, submitting data. We'll talk about the performance categories, and we'll wrap up with scoring. Part two of the discussion structure is, how do I prepare for and participate in MIPS? And this is really the how do I do it portion of the discussion. So this is where we'll talk about some tips on how to take these policy elements and requirements and really put them into action for the first performance year. So we're going to jump to the next slide. And it is my pleasure to introduce Molly MacHarris, MIPS Program Lead with the Center for Clinical Standards and Quality, to talk about the MIPS basics and what we really need to know.
Thanks, Adam, and thanks everyone again for being here with us today. So let's go ahead and jump into slide 6. So I'll start talking us through what is the MIPS program. So MIPS stands for the Merit-Based Incentive Payment System. And what MIPS does is it consolidates 3 of the programs that you all may be familiar with. Those include the Physician Quality Reporting System, or PQRS program, the Physician Value Modifier, or VM program, and the Medicare EHR Incentive Program for eligible professionals. Those programs are ending. 2016 is their last year for the majority of those programs, with the last time frame that payments will be adjusted for those programs being calendar year 2018. One piece I do want to note is that the Medicaid EHR incentive program, that will continue, as will the Medicare EHR incentive program for hospitals. MIPS and the Quality Payment Program have no impact on those sides of the EHR incentive program. So let's go ahead and jump to slide 7. So what comprises the MIPS? There are 4 performance categories, which include quality, cost, improvement activities, and advancing care information. And then if we go ahead and jump to slide 8, you can see how if you have participated in any of these programs in the past, how they can relate to these performance categories. So when we talk about quality under MIPS, in a lot of ways it's very similar to the program that is ending the PQRS program. When we talk about cost, it's very similar to the resource use or cost measurement side of the value modifier program. And when we talk about the advancing care information performance category, that really deals with the usage of electronic health records, so similar to the meaningful use program. I'll go over this in a lot more detail later on, but just want to make this clear that what we're talking about for MIPS, some of these pieces are new, but if you have any experience in these programs that are ending, it shouldn't be completely unfamiliar. So let's move on to slide 9. So we've heard a number of questions. One of the questions has been, what do you have to do if you have no previous reporting experience in any of the programs that are ending? Again, the PQRS program, the VM program, or the Meaningful Use program. So what we've done in the first year of the Quality Payment Program is we have implemented a pick-your-pace approach, which really allows you, the clinicians, to be able to tell us how much you are able to participate in the new Quality Payment Program. There are a number of tracks under the Pick Your Pace, which I'll talk about a little bit later. But what that does is it allows flexibility. There also is, in many instances, for those of you who have really minimal interactions with Medicare, you would be completely excluded from participation, which means that you don't have to participate at all. And again, I'll talk through this in more detail later on. So let's go ahead and jump to slide 10. So when does MIPS officially begin? As Adam noted at the onset of this call, we are in the beginning of the overall performance period. 2017 is the performance period, so any 90 days in 2017, that's when we would look to see for folks to participate. Then we would look to have all data submitted to us by no later than the end of March in 2018. We'll then give you feedback on all the data you've submitted. And then beginning in 2019, that's when your claims will begin being adjusted under MIPS. Under MIPS, the adjustment percentage is 4%, which can fluctuate depending upon what your total score is. And on the next slide, slide 11, I'll turn this back over to Adam to talk through a lot of the technical assistance that we have available.
Okay, thanks, Molly. The one thing I want to point out here, and this is very important at the very top of this, is the technical assistance program that we have to support the Quality Payment Program, both MIPS and Advanced APMs, is free. This is free support to clinicians participating in the Quality Payment Program. And I spoke with a clinician a few weeks ago, and it was actually an interesting story, and she refers all of her colleagues to the technical assistance programs because it is free. And she said there's not a lot you can get free anymore, and this is one of those programs. So we certainly encourage everyone to participate, take advantage of this opportunity. There are 3 major components of the technical assistance program. We have the Transforming Clinical Practice Initiative, the Quality Innovation Networks and Quality Improvement Organizations, or the QUINQIOs, and the Small, Underserved, and Rural Support, which we have titled the QPP SIRS program. The QPP SIRS program really is for those small practices with 15 clinicians or less. We are working to get the CSRS program out there and get it going. We anticipate this in early 2017, so it is forthcoming. But all of these programs will help with a number of different elements. So some of the examples include understanding MIPS expectations and timelines, reading MIPS feedback reports, creating a score improvement plan. Some more of the broader elements are evaluation of practice readiness and practice facilitation, assessment of health information technology and optimizing that information technology, change management and strategic planning, and the list goes on. I mean, all of these technical assistance organizations are well equipped to prepare you for the quality payment program and to really help you participate and succeed. One thing I also want to mention is that we have a no wrong door approach for the technical assistance program. So no matter where you reach out, so if you reach out to the CSRS program or the QuinnQIOs, and there may be a better fit for you just based on your practice size and your patient population, we'll make sure you get to that right door, the right entry into that right door. We'll get you with the right program, and we'll make sure that you have all the assistance that you need. Aside from these three major technical assistance programs, we also have additional support available through the Quality Payment Program website at qpp.cms.gov. There's a lot of great educational resources out there. We also have the measure selector, so you can take a look at the different MIPS performance categories and the measures that are available. We also have the Service Center with the information available on this infographic. And for those who are in alternative payment models or advanced alternative payment models or are interested in additional information, we do have the Innovation Center's learning systems, which is available to provide support for those in APMs and advanced APMs. So again, these are free resources. Please take advantage of these. They are ready. They're here to help, and they're ready to go.